Well, good afternoon. Welcome to our next Senior Wellbeing Lecture Series. We're really excited that you are here and we can all learn together about Thrive 55. Before I make the introductions of our guest speakers and make a couple of brief announcements, let us pray. Gracious God, we are grateful to you, O Lord, for this day of life. May we notice the beauty all around us as we strive to live more and more into your image. Help us to thrive. Help us to love others as you love us. In Jesus' name, amen. And I think most of you know I'm Pastor Lori, one of the pastors here, just back from sabbatical, and I'm happy to be back with you. You may know that we began as a caregivers ministry for those who are caring for people with dementia, and we have grown our ministry. We are now open to all caregivers, regardless of why they are providing care. So if you know someone who is in need of extra care because of their role as a caregiver, reach out to us. We really want to open our arms wide for anyone who is offering care. Second, we have a new support group for caregivers that is meeting in person on the third Mondays of the month, so at 10 a.m. So September 18th is the first one, I believe, and it is with trained facilitators. So again, if you would appreciate that support group, or you know someone who would, just show up in our resource room, and you will be well cared for as you support one another in that group. So now I get to introduce Kim Brown and Emily Orender. Kim is the supervisor of Sarasota Memorial Hospital's Outpatient Behavioral Health Sciences. She is a behavioral health clinician with over 14 years of experience providing services to individuals and families in residential, hospital, outpatient, and intensive outpatient settings. Kim is a licensed clinician and is a certified supervisor in the state of Florida. She enjoys working as a therapist to see the positive growth that can be made when individuals are given the tools for success along with a supportive environment. And Emily is the admissions outreach coordinator for the Thrive 55 program at Sarasota Memorial Hospital. Emily has a bachelor's degree in psychology and a minor in criminology from Florida State University. She works with seniors, their spouses, and caregivers to connect them with area resources. Emily is well-versed in providing person-centered support to clients and their families. Some of you may remember where she and her colleague introduced us to the healing power of sound bathing. And I'm sorry I missed it. I want to do it again. That would be so great. So please help join me in welcoming Kim and Emily.
Thank you so much, Pastor Lori, and thank you also to Pat for having us today and to the Church of the Palms. And we're so happy and excited to be here and to work with you all and present some information, not only about our programs, but just about well-being for individuals 55 plus, and that also includes our mental health well-being. So thank you so much for the opportunity, and I'll turn it over to Emily.
Hello, I'm Emily. I'm the admissions and outreach coordinator for our Thrive 55 program. I've been here since about January, and it's been a pleasure to see the many walks of life since I started. So we're going to jump into a little bit of statistics in regards to aging populations 55 and older, and then we'll have questions at the end. Some key takeaways that we want to encourage you to know is 1 in 5 people are diagnosed with a mental health diagnosis. 1 in 5 individuals who do come to the emergency room are related to mental health services. And 46,000 of those individuals have suicides. And in the United States alone, 9,000 of them were of the age 65 and older. 70% of behavioral health populations are comorbidity, which is 2 diagnoses, so not necessarily just one. And then focusing strictly on Sarasota, this is the population that we do serve. Over 400,000 individuals reside in Sarasota. Obviously, we see growth during certain season times here. National statistics, 80,000 of our residents in Sarasota live with a mental health illness, and of those 80,000, 20,000 of those live with a severe mental health illness. Due to COVID-19, we did see a spike in regards to mental health. A lot of isolation was done during that period of time, affecting all genres of age groups. And as of now, 60 out of the 67 counties in Florida, Sarasota is ranked number 12 for the state of suicides. So that's really information to know because we are such a large population. We serve a population called the baby boomers, so anyone receiving or born from 1946 to 1964 are typically our higher suicide rate just due to walks of life. What does it look like to them? Have they recently retired? Are they going through the process of, okay, my job has been my life for so long, I'm now transitioning to a new part of my life. Out of the demographics, we're expected by 2030, 71 million Americans to be 65 and older. And then some series of risk factors that we're going to jump into. Some important things that we want to share with you all today are symptoms of depression or suicide, risk factors in seniors, like we talked about a little bit before. As a community, anyone 55 and older, there might be some life changes, whether it's we're losing a spouse, friends, having chronic pain, your body's just not as young as it once used to be, your muscles are starting to do things that they might not have done before, your loss of sense or hearing, so maybe you feel as if you're not as 100% once before. Your individuals noticing that they're tearful or crying for no reason, and then noticing maybe there are some sleep patterns that are not as normal as they once were. All right, and our warning signs. From the SAMHSA website, which is documented in regards to substance use, talking about warning signs, focusing on wanting to hurt yourself or kill yourself or wanting the need to die. That's something that oftentimes we hear from individuals. What your burden at this point, maybe your kids are now caring for you, things of that nature. Increase of alcohol or drugs, anxious, feeling reckless, maybe certain behaviors, feeling angrier without being able to explain why, are some warning signs. Sleeping a little, sleeping too much, is that fluctuating through your day-to-day routines. Feeling withdrawn or isolated. Sometimes it's easy to kind of withdraw from those social settings, so things like this are really important to engage in, finding a community of your own, getting involved with others who might have the same interests of you. Showing range of talking, seeking revenge, obviously, and then again, displaying extreme mood swings. So things that you haven't noticed before, maybe it could be of someone you know or something that you've heard of. Again, your emotions are fluctuating and anger is occurring. So Kim's going to talk a little bit about some therapy styles and a little bit more.
All right, thanks for the statistics, Emily. So statistics are just statistics, but the good news is all of the things that we can do when we see warning signs, all of the help that is available for someone who is struggling with something like anxiety, depression, or even suicidal thoughts. So one important genre of help is in psychotherapy. So psychotherapy can be individualized services where you're one-on-one with a counselor, or it can be done in a group format. If you've done a lot of individual therapy, sometimes it's nice to try something different in a group format, and we have both of those sorts of interventions available at SMH Outpatient. And I am a therapist, so of course I'm pretty excited about some of the different interventions, and so I want to share some of those with you. There are specialized interventions for individuals who have struggled with psychological trauma in their life. So the medical community thinks about trauma as, the helicopter flying in and someone may have a serious injury. But we can also have what's called a mental health trauma. Mental health traumas include things like being the survivor of emotional abuse, sexual abuse, physical abuse, living as a child in a home where you felt neglected or with a parent who might have been addicted. All of those things are mental health and psychological traumas. And what we've learned over the years is that what happened to us does matter. It's not a life sentence by any means. People overcome trauma all of the time with proper treatment. But if you've ever wondered, if you're someone who endured some trauma and you think, why do I have depression or why do I have anxiety? That might be one of the reasons, is that you have suffered some trauma that remains untreated. So there are some specialized treatments, things like rapid resolution therapy or EMDR therapy that would specifically address those traumas. So I want you to know that's out there. There's even a phenomenon called post-traumatic growth, which is a phenomenon where individuals who've had great traumas in their life, if they receive treatment, actually come out on the other side and seem to really soar. We can think about celebrities that Oprah Winfrey, Tyler Perry, the gymnast Simone Biles, that have went through traumatic experiences and then, seem to go on and do great things in life. So I want you to understand, there are treatments available, and it's certainly those symptoms can and will get better with treatment. Some other psychotherapies, things that I like to use, include cognitive behavioral therapy. So cognitive behavioral therapy is really about attacking thoughts. So there's a triangle, and it goes like this. You have a thought, and the thought results in a feeling, and the feeling results in a behavior. So it's a triangle. So if I want to change a behavior, or I want to change how I'm feeling, sometimes I need to attack it at the thought level. So a simple explanation of that is if I'm walking down the street and someone bumps into me and steps on my toe, and I think they did that on purpose, what might my feeling be? Angry. What might I do? What's my behavior? Yell, scream, who knows, right? Okay, now let's go back to the thought level. What if I thought, I don't think they saw me, that was an accident? Now what's my feeling? Right? And now what do I do? What's my behavior? Yeah. So it's the same event, was it not? But how we thought about it made a huge difference in how we felt and what we did. So that's a very simple example, but in all things about our life, we have thoughts about that. And one way to feel better or have different behaviors is to go back and look at our thoughts. Cognitive behavioral therapy helps us attack what are called cognitive distortions. So as I say these, you're definitely going to resonate with these. I know I do. We can do things like mind reading, which is where we think we know what that lady over there is thinking about us, right? And that's certainly going to change how we feel and what we do, right? Okay, so we can also think about a cognitive distortion, fortune telling, where we think we know this is going to happen, and then this is going to happen, and then this is going to happen, and we've created this entire story that just simply isn't true or evidence-based, right? We have no idea if that's what's going to happen. It's just a story that our mind created. And another one would be catastrophic thinking. So someone doesn't call you that you expected to call, and you jump to, they're on that helicopter to trauma at Sarasota Memorial, right? That's an example of catastrophic thinking. So you can think about all of your thinking traps and know which ones that you're susceptible to, and work in CBT therapy to try to recognize and interrupt those thoughts. So it's really helpful with things like depression and anxiety. And then I want to tell you a little bit about acceptance and commitment therapy. So this is a newer therapy, and it's one of my favorites. I use it all the time. It's about identifying what your current values are. So the funny thing about values is we think we know what our values are, but when's the last time you really thought about it? Right? So do you know what matters to you right now? I'm not talking about what mattered to you when you were working and when you had kids and when you were 30 years old, but what matters to you now? Have you thought about that? Okay. So acceptance and commitment therapy says if you don't think about that and you don't know what your values are, you're not headed in the direction of happiness. So if I know what my values are and I start doing things that align me towards my values, let's say it's spending time with my family, let's say it's spirituality, and I start doing things, then that's correlated with happiness. But what happens is we get hooked by a thought, and the thought starts to pull us this way, somewhere else. For me, what's important for my life right now is spending time with my family, but guess what I get hooked by? Work, right? So if I'm moving this way, I'm moving away, so I'm making an away move. So acceptance and commitment therapy teaches you how to diffuse from thoughts and things that take you away from what really matters to you right now. And really thinking about, is this something that it's important to me right now, or did somebody put this on me? Is this what my husband thinks I should be doing? Is this what my parents always told me would make me happy? So that's a kind of a new, really cool genre of therapy that we do. There's also medication. I don't have a slide on this one, but medication interventions can be very important for things like anxiety and depression. And for most things, that combination of therapy and medication colliding together, create some of the best outcomes. Something new that has come out is called TMS. Has anybody heard of that? Yeah? Okay. So I don't know a ton about it, but it's going to be in our new Cornell building, and we'll tell you more about that building at the end. But we're going to be offering TMS services. It's very short. I understand it's about 20 minutes. It's non-invasive. You don't get put under or anything like that. It's a magnetic field. I'm not going to go too much into it because, like I said, I just don't know enough about it. I'm not the physician for that. But it is a treatment for depression, anxiety, and chronic pain. So those are some of the things that we can do as far as treatment. But I wanted to go back to some of the signs and things that Emily was telling us about. If you're experiencing some of those signs or symptoms, or you have a friend or a loved one or a spouse who is, I want to go through some of the things that you can do, okay? So one thing, if someone comes to you and it sounds like they're having some thoughts of self-harm or they might be having a mental health crisis, you don't have to solve the problem. All you have to do is be the listener, okay? Usually just helping the person know that they're being heard and that their struggle is validated is very effective in that moment. So if you can do that piece, you're going to be very helpful. Just staying calm and offering, saying things like, hey, would it be okay if I called to get you some help? Or, would it be okay if we go to the ER? And don't promise to keep something a secret, especially if it has to do with self-harm. So there's a course that anyone can take called Mental Health First Aid. That's a very good online course, but they have an acronym, ALGEE. It's first assess for risk of suicide or self-harm. You can directly ask that question. If someone or you are having those kind of thoughts, then you need to get to professional help. And that can be, a lot of people don't know, you can call 911, or you can even call the non-emergent number at the police and request a wellness check on someone. So if you're not sure, they'll go out to the house. We do it sometimes, and just interview that person and make sure that they're okay and they're not in need of greater services. Again, just listening, giving reassurance that you're there to listen, encourage that professional help, and encourage support. Again, just practicing that active listening. So how you do that with a friend or someone you love is, the nonverbals I think are the most important. Even as a therapist, a lot of times what we do is be a sounding board. So the individual knows the answer sometimes, but they just need somebody to reflect off of. So it's really about, an empathetic nod and kind of, honing in and listening, giving that nod, rephrasing so what I'm hearing you say is, when you wake up in the morning, sometimes you feel like such a burden that you don't even want to go on with the day. And usually the individuals say, yeah, that's exactly how I feel. So paraphrasing, just looking at part, really just letting them know that you're listening. Be very direct and talk very matter-of-factly if you're worried that someone is having suicidal thoughts. People become afraid that if they mention that word, that they will put the idea in someone's head, and that's not true. That's been researched and is actually the opposite. So usually people are quite relieved that you ask the question, have you been thinking about hurting yourself? Do you have a plan for suicide? And so that's actually more helpful. So don't be afraid to directly ask that question. Be non-judgmental. So don't start in that moment. It's not the time to say suicide is wrong, or you know where you'll go if you complete suicide. Right? Don't debate like life is very valuable. No, remember, you're just a listener and you're just paraphrasing and connecting to help. Definitely don't dare anybody to do it. Don't try a counteractive approach. Don't act very shocked. Just act supportive. Don't be sworn to secrecy. Again, offer different options. Okay.
And then I'm going to jump back in. So Thrive 55, like Kim had mentioned, we're going to talk a little bit about the Cornell building and the different things that are coming along with it. We're moving in December 5th, but as of right now, as of January, we started our Thrive 55 program, and as of February, I want to say the 14th, Valentine's Day, we got our first client. So what that kind of process looks like and how it might benefit or different things that we could offer an individual. So first off, what makes you qualify to be in Thrive 55? So obviously I've said it 100 times probably in this little setting, but anyone 55 and older looking for community service, networking, and support. So we have different types of programs. We offer what's called an IOP program. It is also known as intensive outpatient. This is a program that runs 3 days a week, 3 hours a day, total of 9 hours. So it's a little more intensive than just a casual, I'm going to meet with you once a week and I'm going to see you next week type thing. You're with a group of individuals who are also 55 and older. We see kind of in our PHP groups, which is partial hospitalization, which is 5 days a week, that sometimes it can be a little overwhelming to walk into a room when you're 65 and you're sitting next to a 20-year-old. Maybe you feel that that individual doesn't have the same life experience or they don't really know what you're going through. So we are able to connect those individuals to a cluster that are, walking the same stages of life. Connect group, this is something that we're promoting in the coming months. Anyone who's received our services, it's more or less like a social event where you come in for 30 minutes to an hour, chit chat with your pals that you've had these groups with and just kind of connect again. Where are you going? What services are you involved in? How to interchange and connect again, like we talked about before. Taking yourself out of the isolation is what is going to be most important in these stages. Sound relaxation. We got the opportunity to come in with Pat about a month ago, and our coworker Tiffany, who obviously is not with us today, she has been certified in sound relaxation. I can't tell you all the nitty-gritty things of what it is. All I know is that it is so relaxing.
Makes me fall asleep.
It is very much a stress relief, so we were able to do it with the caregiver support group here last month. It's about 30 minutes. You just kind of sit, listen to instruments, bowl things that she does, but it is really beneficial. The scientific effect of it is because of how the bowl, like the vibration is how it connects in the brain. There is a sheet up there that talks in detail about what exactly it is. So if you're interested, you can check that out. And then again, we also are coming up with a support group. I don't want to take away with what's going on here. So again, making sure that you're connecting with individuals who know what you're going through as a caregiver, things of that nature.
Can I jump in a little bit on that? So the 55 and older is one qualification. Another qualification might be relevant to someone you know, is that we also offer these services under Thrive 55 for someone younger than 55 if they're they're a caretaker of somebody who's 55 plus. So it could be a 25-year-old taking care of their grandmother who has Alzheimer's, and we would offer that mental wellness one-on-one sessions for that individual to come in and talk with a counselor, talk about the stress of being a caregiver. So that's another way to qualify. So just to summarize the services, so we do have the individual one-on-one mental wellness coaching sessions with a counselor. I can explain, I was doing some of that ACT type therapy with one of my recent clients, and she recognized that what she hadn't been doing was having fun. And she said, that was my value. When I retired, I thought, woohoo, I don't have to work, my kids are gone, I'm gonna have fun. And she said, but it's not fun. I'm bored. I sit in my house and I do dishes and laundry. And so once she realized that, she just came back, I think yesterday, and had gotten a puppy and said, now I'm going to go look for clothes to dress them up for Halloween, and, I'm going to teach him how to do tricks. And it was just identifying that, wow, I didn't even think when the last time I laughed was, but it was a long time ago. So she then took that committed action, right, and did something about that. Some other clientele, as a matter of fact, her husband also comes in. She has some mild cognitive decline, and so he comes in as a caregiver and has some of those coaching sessions as well. Some other folks, I know I have one individual, he comes in and he says, I just don't have anybody to tell about my day. There's just nobody left, or everybody is too busy in my family, and I just like to come in and have you just kind of listen to what's going on, and I haven't gotten my dentist hasn't called me back, and it's really frustrating. So it really kind of depends on what the individual wants to work on. And then, as Emily mentioned, the IOP program is a little bit more. That's that 9 hours a week of group and some individual along with that, and also visits with the medical staff. So that's a time-limited program. Most folks are in that about 6 weeks, and it's that intensive, almost like a boot camp of coping strategies, and also those medical visits to maybe either start a medication or get another opinion on the medications that someone might already be on, and then going back to your other providers. And I think, and then the sound healing and the support groups are the other piece of it. So just wanted to kind of reiterate those services.
When you walked in earlier today, we passed out some surveys, but also scales. Those are our general anxiety scales that we typically give out to every individual who's coming in for an assessment. What our assessments normally look like is about 45 minutes to an hour with an individual therapist, getting to know what their goals are, what are they wanting to reach for themselves. That can transition into what we call mental wellness coaching. This is one-on-one coaching with one of our therapists on staff. And again, based on what their needs are, it could be once a week, it could be once every other week, it could be once every 3 weeks, maybe even once or 2 times a week. It just kind of varies on where you are. It's really encouraging to see, from the beginning, when they first complete their scales, what they're looking like, how they're expressing themselves to when they're discharging from the program. We had an individual who scaled significantly high, and by the time they left, they were very minimal, moving back home, feeling like they were confident in themselves, back to their mobility, all of the things. So it's been very encouraging on my end to see those things, and I'm sure as well for all of the rest of our staff. A part of my position is support services. So say you know someone who might be interested in things but really don't know where to start. My goal and job is to get them connected to those things, sending out the referrals, talking, waiting on the phone for the people when it's hard to get in contact with. I'm a very patient person, so sitting with someone who might not be as tech savvy, I don't mind it at all. So that's another benefit of, the programming itself.
I'm glad you mentioned that, Emily, because I know a lot of out in the world, everything's going to telehealth, a lot of things. And so that is one thing that we offer is let us help you figure out how to do your telehealth appointments. If you're connected to a psychiatrist or something, let's put your app on your phone and teach you how to do that. So that's something that's helpful. The one-on-one coaching, one thing that I wanted to mention about that is it's free. So the mental wellness coaching sessions, if an individual qualifies at that level, it's not billed to insurance. And there's no cash pay, there's no copay. The IOP program is insurance driven, so that one, you do have to have some type of coverage, or in some situations we're able to qualify certain individuals for charity funds. But the mental wellness coaching and the support services, and also the sound healing is free. So all of those services you can come in for and schedule for free.
All right, and then again, these are just certain levels of community resources. So we have mental health services, residential, that's, being at a facility for, it could be 3 weeks, could be a month, whatever it might look like. We have what's called a crisis center at Bayside, so maybe you know an individual who is in crisis, but you're not quite sure what to be doing. When we transition into our new building, it will be 24 hours, 7 days a week. So anyone could call and say, this is the situation, should I be bringing them in, can we talk with them? And they will assess them to determine if they're inpatient or if, they can get them set up for potentially coming to our programmings. Again, like we talked about, our PHP, IOP programs, Thrive, IOP, and individual wellness coaching, substance use services, same concept, residential, you're living there. It's very strict and geared towards that focus. Certain types of treatments, support groups, and individual therapy. Other resources, crisis line 988, that is really, really, really helpful. They have all types of services. If you know someone's in crisis and they want someone to talk to, they are 24/7, 7 days a week.
Have you all heard of 988? It's like 911, but it's for behavioral health. So it's pretty new.
And then 211 is another service that offers an allotted things. Say you're looking for food stamps, or say you're looking for community network. You call them, say what you're interested in. They have a wonderful database that can tell you all types of things. They are also crisis, so if for some reason you couldn't be in contact with someone and you needed to call just to talk to someone, they are a resource as well. And the most exciting thing is we do have our new Cornell building that is going to be officially open December 5th. They are doing all types of trainings in the month of November to get all of our staff equipped and comfortable before we are officially moved in. So we wanted to share some pictures of what it might look like from our first floor area, and then kind of share a little bit more in regards to the highlights. So this is if you were to come down Tamiami and, well, I'm thinking now, Waldemere, a lot of construction's going on if you haven't been to SMH recently. So this is the layout. We recently got all of our palm trees and landscape put up, so it's starting to get more and more put together. So that's what it'll look like from the outside. And then when you first walk into the lobby, this is going to be your lobby entrance. So the idea of the building was we want it to be light, we want it to be enjoyable to walk into. Sometimes buildings are a little gloomy and yellow lighting and all those things, so we wanted to make sure that we captured the natural light aspect. Oh my goodness, my words. And then our outpatient lobby. So this is where myself and Tiffany will be sitting, and you walk in, you're greeted, and then we will have individual therapy rooms, group rooms, relaxation rooms, and all the things above. So we're eager beavers to get in there. And then here are general resources. And then I think that we're going to talk a little bit more in regards to what Cornell is, what it's looking like. So
Sure. So the services we were talking to you about right now at outpatient, a lot of people don't even know that Sarasota Memorial has outpatient behavioral health because it's always been those intensive programs, the IOP and the PHP, but now Thrive 55 lives there right now too. And that's on the bottom floor of the Heart Pavilion, not in the main hospital, but right next to it. But as of December 5th, as Emily mentioned, we would be moving to the bottom floor of the Cornell building. And so on the top floors of the Cornell building, we'll replace the current Bayside inpatient. So, it's a continuity of care there too to help individuals get back and forth between all of the different programs, but we'll be right there on that bottom floor. So it is a $71 million facility. So it's pretty incredible. I got to walk through it a little bit and see how even our group rooms for our programs, currently there's no windows or anything, but there's like etched glass so nobody can see in, and you can't really see out. It's kind of fuzzy, but then at the top it's glass, and you can feel the sunlight and see the lights throughout the day while you're in those group services. So that's pretty neat. Let's see. It says it's on the corner of Osprey and Hawthorne, just walking distance from the main SMH campus, and does have 4 inpatient units and then the outpatient services.
So if you've ever parked in the parking garage attached to the main SMH campus, we're going to be right next to it. So that's all we have. Does anyone have questions? All right.
All right, hold on just a second. Mike, there we go.
So inpatient, I'm curious about that. You said you have 4 groups, or I can't remember exactly what the term was.
4 units, yeah.
Okay, 4 units. Are they segregated according to age? So if somebody goes in and is inpatient, they're not going to be with an adolescent?
Yes, absolutely. So there are 16 beds that would be the senior or medical beds. So specifically maybe someone who might be prone to seizures or has a CPAP machine or is prone to falls, for example, might be on that unit. Older adults, but not necessarily just older adults on that unit. And then there's a 22-bed child and adolescent unit. And there's a 24-bed adult unit. The adult unit usually houses individuals that are suffering with things like depression or suicidal thoughts. And then there's a 22-bed acute care unit, which is more for individuals who might be suffering from some psychosis or some bipolar mania symptoms. Yeah, great question.
Okay, so lots of really good resources that you've offered, but I have a really important question because sometimes there's a mental health crisis that's not a psychotic event.
Right.
Anxiety, panic attack, that kind of thing. The ER is not the place to go. What is your recommendation?
Yeah. So Emily had mentioned the CAC Center. That is connected currently to Bayside, but then also will be in Cornell. And that's specifically behavioral health as opposed to just general ER. So someone can walk in there and be, meet with a counselor and be screened to see what level of service. I know in our intensive programs, we get some referrals from that. So someone has walked in, they don't need inpatient care, but they needed, a little assistance and direction. And then maybe they might come to what's called our IOP or PHP program, which is that more intensive. If anybody is waiting out there for a psychiatrist, some of you might know, sometimes the waits are 2-3 months, and it's too long. Where if someone comes to one of our intensive programs, they can see a medical staff within a couple of days. So sometimes that's the answer, like a more intensive program.
Yeah, well, if you couldn't tell, I have an experience. I had gotten my husband off of a few meds, and it was about 6 weeks after that he had really a rebound effect. And it was purely anxiety. But he was feeling like he needed some help. Now, it was on Sunday afternoon, so I'm guessing that what you're talking about isn't available on Sunday afternoon.
The CAC will be available 24/7 at Cornell when we move over to Cornell.
Okay, so that's good to know.
Yep.
So what I did, I did all the things you mentioned, and I was trying to listen and not be judgmental, but he felt like he needed some more help. And in that moment, I didn't know what else to do, so I tried taking him to, like, urgent care. Of course, because he's 85 and he's got comorbidities, they freaked out and they were scared of him. You need to go to the ER. Well, especially now that SMH is a trauma center, if you're not actively dying, you're not important in the moment. And I understand that because you got to prioritize. But I couldn't get him to leave because he goes, no, we've already signed in, we have to stay. And so here I am left to try to deal with my husband in a high anxiety moment, in a high anxiety facility.
Sure.
With no resources.
Right. Well, that's not an uncommon story. I've heard definite stories, especially in the case of panic attacks, and things like panic attacks are really scary. Individuals feel like, they're having a heart attack or I'm dying, is the thought. Sometimes it does require some reassurance from medical staff for that person to calm down. But
they were useless.
Yeah, sorry to hear that.
They were completely useless. Oh, we can give him this, that, and the other med, which I had just gotten him off of, and those meds all take 6 weeks to kick in. And it's like, no, we have an emergency now. I need something more fast acting. And they were frustrated with me because I wasn't supposed to know that.
Yeah, there's not too many like on-call, not a hospitalization. I know what you're saying. I guess my best, it wouldn't help you in that moment, but to avoid future moments like that, working with a counselor, I don't know if he does already, but to do, if he was my client, for example, what I would do is arm the both of you with things like havening, where it's some simple things like this that you do over in, or tapping. There's certain tapping procedures. So something that you feel like you have some like first aid in the moment, to try to get someone through that.
Yeah. And we did all those things. He was just feeling like he needed more. He's got a counselor.
Yes, those are really scary.
He just felt like he needed something more, and I felt like I needed to support him in that. And so 6 hours in the ER for no good reason. And it was just awful. And, like I said, I understand the priority, but.
Yeah. I'm hoping Cornell will help alleviate some of that.
Can you say a little bit more about the first aid type thing, because that certainly would be helpful in that situation where you don't know what to do and help is on the way, but it's not here.
Right.
What would that first aid look like?
Yeah, if you think someone is having a panic attack or feeling really anxious, I have a lot of what we call, the distress tolerance skills. So I showed you that self-havening one, and you can kind of hum with it or sing like, row, row, row your boat. I know it sounds silly, but sometimes the silly things are the things that work. Doing something like this and just kind of alternating that havening. Another thing that we do in our program is, go open the freezer and put your head just like this, right? Splash cold water on your face. The reason for that is because, if you ever run and jump and dive into a pool, what happens? Right? Everybody know that feeling? Okay, so holding a piece of ice or splashing water in your face or opening that freezer is designed to reset that vagus nervous system, right? And so you get that feeling and kind of bust you out of that anxiety feeling. So those are some of the go-to things that I would recommend. Another thing would be like even just like taking salt or pepper and putting it on your tongue. These are some what's called DBT skills. Anything to kind of like shock that system out of that loop of anxiety.
Other questions?
What does that do to you when you put salt and pepper on your?
Well, it's just like it's a sensory, and it takes away if you're stuck in a thought of like, I'm gonna die, and you're really not gonna die. We know it's not a heart attack or something like that, and we think it's anxiety. Anything with that like that cold water, or putting something like sour lemon or salt or pepper, it just kind of like it's really hard to focus on what you were thinking about if you just put salt on your tongue, right? So it's using your senses to kind of pull you out of that. Yeah, a couple little first aid skills.
I apologize, I missed the first half hour. Would you repeat all that? But I was curious because you mentioned sound therapy, and I just want to know, and you probably explained it, but if you would repeat what you said about that and what exactly, what programs do you use? I'd be curious.
So we have an employee with us who is certified in sound relaxation. So what it looks like is bowls, per se, musical instruments is what...
There's like a gong
Yeah.
and like these things that sound like rain.
So it kind of affects the brain waves, you know, what the sound, what it's channeling, how it relaxes your body. And then what I can tell you is there's a paper that tells you in great detail what it is, because I would butcher it if I tried to explain it, what exactly it is. The other thing is just to experience it. Laying down on a mat, having a galaxy above you where you're focusing on this, you're not focusing on your breathing, you hear these sounds. So allowing yourself that self-care moment of let me have 15, 20 minutes to focus on me and have my body relax. You know, other people resort to walking, other people resort to reading. This is just another form of self-care.
Yeah, I know some of our folks will do their mental wellness coaching, and then they'll do like a sound relaxation afterwards, just to treat themselves, much like you would get like a massage or something like that. I think what's different for me, I know I've had people ask before, they say, well, you know, can't I just put like rain sounds on my phone or something like that? It really feels different because the instruments are kind of playing all around you. I don't know how she makes it sound like that, but they're like all around you. And then she puts up like these visual stars and things, so it's just a nice little relaxation. So I know we used it a lot for caregivers too, that, you know, really just need a little bit of me time.
There are a couple of caregivers in the room, I think, that were at the one that we did,
Yeah.
and it is amazing. 20 minutes and you are a different person. Whatever you came in with is no longer there. And I think it's the frequency and the changing sounds that do it as well, because what I found so interesting is I wasn't in the room anymore. I was on the beach. And as the sounds occurred, it was like, oh, those are the birds taking off the way they do at sunset and that sort of thing. But if you've not had the experience, you should. And the real goal is how we can do it on a regular basis, because I think it's 20 minutes of excellent therapy. Other questions?
I was just down at, was it Baycare Mental Health, the other building, the one currently?
Oh, Bayside?
I guess so, yes, and I hadn't been there before. And I was just curious because I would just like to know how, when somebody comes in to visit somebody as a visitor, what can you expect when, because I had to present ID, and this has probably been going on for years. I had to be photographed, couldn't bring a gift in. So I'm just wondering, is this going to be the same, or maybe it's all case specific, but.
Yeah, so I know a little bit about that. I don't know a lot about that because I'm in the outpatient department, but I know they are very careful on what comes in, and that's because they don't want anything that might come in that someone could harm themselves with or break and use as a sharp, or anything that anyone could hang themselves with, for example. So that's why they're so careful about, you know, not bringing anything in. But it's not the same as like when somebody's in a medical hospital and you can send flowers and things, which is unfortunate. But that's the reason why. And I think the photograph, is that for your label, you know, so that they can see, you know, who visited that person. And I think they do the wand on you, right, to make sure that there's no, you know, weapons or anything like that. You know, there have been cases, not here that I know of, but other places where, you know, someone asks, you know, bring me a knife in or something, you know, we definitely wouldn't want that. I think in the Cornell building, though, it's not that wand, it's as you walk in, you just walk through it, kind of like an airport or something, but it doesn't look that way. Like, you don't necessarily know it's there, but it's kind of screening that no one has any weapons or anything like that. So I hope it'll seem less, intrusive, than it is currently over there at Bayside.
It's just interesting because you're trying to make people feel happy or what have you. You can't even bring in a plant.
Yeah.
So, but anyway.
Yeah,
that is
yeah,
it.
and that's because of the suicide risk or risk of a weapon or something being thrown. Yeah, it is unfortunate. Downstairs in the outpatient, we don't have any of that because we are an outpatient program. So, upstairs it would be that inpatient program, but in the outpatient, you can bring your purse. You can, it's just like going to the doctor.
Kim, I've got a question.
Yes.
What would you tell us about the stigma of mental illness
Yes.
and how important understanding mental wellness is?
Yeah, thank you for that question. I think that's such an important question, and I think even in my generation, I'm in my 40s, but I still feel like it was very stigmatized. I think that's getting better as we move forward, and I think one thing that shows that it's getting better is that people were willing to put their name on this building, and I think in the past people maybe wouldn't have done that. So people now, after COVID and some of the events that, shootings and things that are going on, I think that people are realizing how important mental health is in our whole being. That, physical health is important, but so is mental well-being. So I feel like it's getting better, but I feel like some of the old ideas are definitely still carried on. But our ability to have conversations like this, in a setting like this, let's come to Church of the Palms and talk about mental health is starting to break that, don't you? Something that maybe would have been not even thought of years ago. So I think, that you all are pioneers in that respect. So thank you for that. I know that I believe it was the Target CEO who's open about that was one of the, individuals who donated like $10 million to this project. So, hearing that people like that are willing to put their name on things like this, I think really matters. The other way that we break down that stigma is by talking about our own services. If you're comfortable with it, say, hey, I'm going to see my therapist today, right? So just like you would, hey, I'm going to see the dermatologist today. So I think that helps break down that stigma because more people will go for help if they feel like they're not judged.
And earlier.
Yeah, absolutely. Or maybe hearing your story is going to be like, oh, well, if she could, say that out loud and go get help or go to group therapy, then maybe I could too.
Thank you. Any other questions?
In your new facility, what about Baker-acted patients? Are they going to be going through the Cornell building, or are they going to be going into another building?
They will be going to the Cornell building. Like Kim had mentioned before, all of behavioral health will be located at this building. If you're experienced Baker Act, they're coming in from a different location than your main lobby. So it's kind of more or less behind the scenes because sometimes that can be a little overwhelming to see maybe if you've gotten the courage to do a program like this. So they've definitely thought out all of these things. The acute facilities will be on the top floors and all outpatient services will be downstairs, but it's not connected. The one beneficial thing is because we're finally all in a building, the communication of, hey, we have a patient that might be beneficial for this service. Well, cool, now I get to hop on an elevator and just go up and talk to them instead of having to say, well, I'll see you in a week when you come, So the flow of communication and collaboration is definitely there.
Yeah, so one other answer to that question is someone could be in the medical hospital under a Baker Act for a little bit of time. Like, let's say someone did unfortunately act on some suicidal thoughts and take an overdose. They may need to be medically cleared. So someone may be on what's called a Baker Act, which is, if you don't know what that is, it's a psychiatric hold. It could be for psychosis or suicidal ideation or thoughts of harming others. So if someone is on that kind of a hold, but they have taken some medications or maybe cut themselves, they may be in the main medical hospital until they're cleared by medical physicians, and then they would move over to the Cornell building for the remainder of their treatment.
Any other questions? Going. Okay, you've been given an evaluation These ladies would like to get some feedback on whether this was helpful for you today. If you don't want to fill it out now, you don't need to, but would you bring it back and leave it in the church office? If you do fill it out now, just go ahead and leave it on the table as you leave. But can we give Kim and Emily our appreciation, please?
Thank you guys for having us, and
If anybody did fill out that anxiety scale and you're curious, we'll tell you what the scores mean. If you would like to know that, you can write it down.
all right, so anything count-wise, so obviously it's rated 0, 1, 2, 3. Typically on my end, I don't scale numbers 26 through the rest. It's only 1 through 25. If you had 1 through 11, you'd be scored minimal. If you had 12 through 21, it would be mild. If you had 22 through 27, it would be moderate. And from 28 to 54, it would be considered severe. Anxiety? Correct.
Anxiety, yeah.
Yep.
We also do a depression scale. We didn't bring that one today, but this is an example of one thing that helps us. This is an evidence-based tool, so you can get some kind of feel of the symptoms somebody is having.
So at what point do you recommend that we seek help?
I would say at mild. Even at mild, you could try some self-help there, and if that doesn't relieve it, go ahead and get some tools and tricks. Learn how to do the tapping and the havening and different things that can help you out. Why let it escalate to moderate or more?
Thank you guys very much for your time.
Thank you.